Philips is a global company, and about half of our business is in healthcare. We set ourselves a mission to improve the lives of 3 billion people per year by the year 2025. And we measure that impact through healthcare and meaningful innovations in the same rigor as our financial performance. And I think we are quite unique in that sense. So we are quite happy to see that the Sustainable Development Goals have a similar ambition to look at how to touch the lives of billions of people through the Sustainable Development Agenda. In particular, we're interested in the SDG number 3, which deals with healthcare and in universal health coverage. We see that there's a huge need to improve primary healthcare in emerging markets and in developing countries. And we've seen that on the ground, that basically the state of primary healthcare is poor. To give you an example, Africa, there are about 100,000 clinics. More than half of them don't have water. They don't have electricity, so no storage of vaccinations. And they have very poorly qualified people and poorly trained people. It's very difficult for those clinics to retain any competent people. Now, what is needed in Africa is about 200,000 of these clinics. So we've invested heavily in how can we improve the healthcare delivery of these clinics with technology like ultrasound, patient monitoring, but also with processes, with training. But more than that, how do we make these clinics sustainable, financially sustainable? Because if we're going to donate these clinics, it's not going to be sustainable. There needs to be a financial model there. And one of the things we did is we developed a primary care clinic with the public sector in Kenya, where we said, look, if we would think of the best primary care center in the world here in Africa, what would it look like? And how could it be affordable for the local community? So we provided solar panels, solar lighting, so the clinic could be open at night. We provided clean water for the facility to meet their wash requirements as sanitation and water, but also for them to sell the water to the community. And we provided technology and training so people could actually provide healthcare. Now, over a year, we've seen the number of patients arriving increase by 600%. We've seen suddenly that the clinic is open at night because there's electricity. And we see that the clinic attracts people, because there's light at night, for social activity, education, so it becomes a community hub. Now, this is the kind of community-based care which we think needs to be replicated around the world. And we can deliver innovations. With the right community engagement and civil society engagement, you can have the oversight from the community that we really meet the demands of the community, not of the governors. And you need the public sector to engage because they need to take their responsibility to improve the quality of care. Yeah, we're working in the Central African Republic in a refugee camp to see if we can provide a clinic which is completely independent of the grid. But what you see, we opened up an innovation center in Africa, in Kenya, to do research in Africa by Africans for Africans, and to really look at, say, what is the context of the citizens, of the patients in Africa, what do they need, and how can we make this sustainable in the communities, in rural communities. That by default means no electricity, or at least no grid. So we have developed, of course, our solar panels. We don't have solar panels ourselves anymore, but we work with partners who develop solar panels. The beauty of solar panels is that they become increasingly more efficient, very efficient. We couple them, of course, with LED lighting. LED has also become really efficient, so you have more power from solar LEDs, less power from LED, so we have excess capacity. So what we were used to just using solar technology with LED lighting, suddenly we have extra electricity which we can sell. Yes, we're working with power storage solutions. Again, we do this in partnerships. Philips is not able to do this by themselves. So we partner with solar, we partner with battery storages, and we actually developed a financial model around this. What you need to get the local ownership is somebody needs to manage the solar panel, the light, and the power, and the accumulators. And they need to be able to make a living out of that. And they need to be able to be supervised by the community, so they are accountable to the people who actually they serve. So what we're seeing is if you put a fence around it, you put a person in there to actually sell the excess capacity, they suddenly have an incentive to continue to generate income and to serve the people who come there with their mobile phones and their other portable devices. So it's through partnership, it's a very nice model which we think can be replicated at scale hundreds of thousands of times.